Do you stand a chance of getting pregnant in your 40s? Is it possible for you to be pregnant at the age of 40? Yes. Hi guys, and welcome back to my channel. If you're a returning subscriber and if this is your first time joining us, welcome to this channel. Today we're going to be talking about something very important: how to get pregnant in your 40s. So if you're at the age of 40 or above and you've been trying to get pregnant, this video is definitely something you'd want to have a look at, okay? At the age of 40, the chances of getting pregnant usually drops to about 44%. And statistics have shown that 1 out of 4 persons in their 20s and 30s would get pregnant in one menstrual cycle, while 1 out of 10 persons at the age of 40 would get pregnant in one menstrual cycle. So, this means that as one advances in age and, the person gets older, the number of eggs in your ovaries actually reduce. Okay, so every female is born with millions of eggs in their ovaries. This drops to like 300,000 eggs left in your ovaries by the time you hit puberty, and it further declines to about 25,000 eggs in your ovaries by the time you're like 35 years and older. And the lower your eggs are left in your ovaries, the lower your chances of getting pregnant. However, who says you can't get pregnant in your 40s? Person is not saying the truth, because it is possible, and that is what we're going to be discussing in this video. The first step here would be staying healthy. I call this the easiest step because this is something that you can do if you're serious about it. And I'm not just here to start preaching about, staying healthy, eating a balanced diet and all this. I'm just going to tell you here for a fact that this is going to help, and I have my proof. Okay, so you have to stay healthy. By staying healthy, yes, balanced diet rich in nutrients, vitamins and all that are very important for fertility. Also, in this step, I'm going to talk about lifestyle adjustments like stopping alcohol, quitting smoking, marijuana, and all sorts of cannabis. So I'm not just saying this for saying sake, but there's actually proof, and I've got evidence that supports this fact. Okay, so studies have shown that you're likely to find it difficult to get pregnant if you and your partner are alcoholics or take alcohol. So for the females, if you're a heavy drinker, it tends to cause irregular periods, problems with ovulation, and even increases your risk of miscarriage. So you wouldn't go through all this hassle and tussle of trying to conceive just to have a miscarriage because you take alcohol. Make it make sense. It's not worth it, sis. Don't you think so? Then for the males, if you're a heavy drinker, it can affect your sperm quality and the sperm volume, which is the sperm count. I know if this happens, it reduces your chances of getting a woman pregnant and causes delays in conception. So for smoking as well, because I said you have to adjust your lifestyle in alcohol, smoking and cannabis. When you smoke cigarettes, cannabis, marijuana, it reduces your chances of getting a woman pregnant, and for you as the lady, reduces your chances of becoming pregnant. It will definitely cause delays, and you wouldn't want that. Also, in the same umbrella of staying healthy, I'm going to talk about STIs, the sexually transmitted infections. So if you have been diagnosed with one, you would also have to follow up with your OBGYN to get treated, because these infections can prevent you from getting pregnant too. The second step that you will take is doing a fertility workup or blood test or imaging test. Here we're all going to discuss that. So here, hormonal imbalance can affect egg production and maturation. So when you meet your OBGYN, if you've been trying to get pregnant and it's seeming a bit difficult, your OBGYN would request for some hormonal tests, okay, to check the levels of hormones that play an important role in the menstrual cycle and you being fertile too. So these hormones would include the LH hormone, luteinizing hormone, the FSH hormone, the estrogen, progesterone, testosterone, TSH, and anti-Mullerian hormone. And I'm going to be discussing the roles that this hormone play shortly so that we can get that. The pituitary gland releases the FSH and LH hormones, okay? So the FSH hormone stimulates the growth of follicles in your ovaries. So these follicles are fluid-filled sacs that contain the immature egg that would eventually get mature and, ready for ovulation and fertilization. The LH hormone, which is the luteinizing hormone, basically stimulates the release of eggs from the ovaries during ovulation, okay? Another important hormone will be the progesterone. So the progesterone helps the body to get ready to become pregnant. It helps to stabilize the uterine lining and also helps the embryo to implant in the womb. The estrogen is another important hormone here. It stimulates the release of the luteinizing hormone, which is the LH hormone, okay, during ovulation. And the estrogen also thickens the wall of the uterus just in preparation for the baby to develop there. And estrogen also helps to thin out your cervical mucus. It makes the cervical mucus to be thin so that your sperm can swim freely. Like when you're having sex, it can swim freely through the cervix and get to the fallopian tubes for fertilization to occur. Another important hormone will be the anti-Mullerian hormone. It determines the ovarian reserve, okay? That is basically the number of eggs that are left in your ovaries. Then the last hormone I'll be talking about here would be the TSH, which is the thyroid stimulating hormone. The thyroid stimulating hormone stimulates the production of the thyroid hormones T3, T4 that are important and play a role in fertility. So when these thyroid hormones, their levels are so low or so high, it can actually lead to infertility. So this is basically like a rundown of these hormones and the functions that they play. Under this fertility workup test, we would also do a pelvic ultrasound scan, which would help to, detect if you have uterine fibroids or any abnormality in the uterus or your womb. Then another important test here, which is an imaging test, would be the hysterosalpingogram. So this is like an X-ray test that a contrast dye is being injected, through the cervix to help visualize your uterus and your fallopian tubes. This is basically done to help detect if the person has any blockage in the fallopian tubes or any tubal occlusion. The third point would be for your male partner or your husband to do a semen analysis. So, the semen is just the fluid that contains the sperm cells that are very important for pregnancy to occur. So in semen analysis, the sample is being taken and the test is conducted in a lab. The sample is being, visualized, or the test is done under a microscope. And this semen analysis checks for the sperm count, okay, which is the sperm volume, the quantity of the sperm cells that are necessary or that you should have for you to get a lady pregnant. The second one would be, the morphology, which is basically the structure of the sperm. The sperm has a head, a middle piece, and a tail. So if you have a sperm cell that has like two heads or two tails or a very big head, so these are like abnormal structures of a sperm cell that can't fertilize an egg. The last one will be motility. So in semen analysis, it will also check out for the motility, how fast your sperms can swim to fertilize the egg, the movement of the sperm. So if you do this test and there are certain abnormalities here, then there might be a problem. Your male partner needs to follow up with a physician to find out ways of, finding a solution for this. The fourth point here, which is also very important, would be knowing your fertile window. So your fertile window is basically the days within your menstrual cycle that you're most likely to conceive, okay? So we all know that the menstrual cycle or the cycle length ranges from 21 to 35 days, all right? So in this illustration, we're going to be using the 28 days cycle length. So ovulation is meant to occur on the 14th day. So this is calculated by simply deducting 14 from your cycle length. So for this lady A that has a cycle length of 28 days, so we deduct 14 from it and it gives us 14. So lady A is meant to ovulate on the 14th day. Okay, let's try another example. So if you have a 30 days cycle length and you deduct 14 from it, you're meant to ovulate on the 16th day. All right, so let's go back to our lady A with a cycle length of 28 days. That is it. Lady A is meant to ovulate on the 14th day, all right? And also, the sperm cell is able to survive in the reproductive tract of the female for about 5 days after an unprotected sex. All right. So let's say the person had sex 5 days prior to ovulation. Those 5 days are still within the fertile window. And another important point here would be that the egg that is ovulated or released, okay, during ovulation would be viable for up to 12 to 24 hours. So the next day after ovulation is still within your fertile window. So 5 days from ovulation and the day after ovulation, that gives us like about 7 days. This is your fertile window. Let's count it. Lady A with a 28-day cycle length ovulates on the 14th day, on day 14. So from day 9, 10, 11, 12, 13, 14, which is the ovulation day, and day 15, these are the days that make up her fertile window. So if you have unprotected sex with your husband or your male partner within this fertile window, you're most likely to get pregnant. Like, your chances are very high of getting pregnant. Okay. The fifth point would be genetic testing. So here is basically testing the genes that carry any genetic disorder in you or your partner. So, abnormalities in chromosomes can actually affect infertility. So during this genetic testing, the doctor would test for any abnormalities in your chromosomes that can actually be passed on to your baby. And if you have any chromosomal abnormality or your partner has any, it will reduce your chances of, getting pregnant. And even when you get pregnant, it would actually increase your chances of having a miscarriage. The next point would be fertility drugs. Okay. So if you've tried getting pregnant the natural way, you've used your fertile window, your partner has done a semen analysis, you've done a fertility workup and checked everything possible, and still it's seeming a bit difficult to get pregnant, you can resort to taking fertility drugs like the Clomid, which is the clomiphene citrate, and letrozole. Okay, so these drugs would stimulate the release of the FSH and LH hormones that would induce your body to ovulate and possibly produce extra eggs during ovulation, thereby increasing your chances of getting pregnant. The last point here would be in vitro fertilization. So if you've tried everything possible and it's still not working, it's not your fault. Okay, so some people that have difficulty getting pregnant, there are certain causes of infertility that are unexplainable. So if you've tried the natural way, done everything possible, it's still not working, you can give this a try. A good alternative would be having an in vitro fertilization done. So here, the mature eggs are harvested from the ovaries of the woman and fertilized with the sperm from the man outside the womb. So the embryo after fertilization is now implanted back into the womb for the baby to start developing there. Okay, so the sperm or egg can be from you as a couple or from donors, depending on whatever your choice is. And each cycle of IVF takes about 2 to 3 weeks. And for some couples, they may require multiple cycles of IVF or more than one cycle of IVF, okay, to be able to arrive at a successful outcome. If you try any of these steps that I've listed out, I believe it will definitely help. Thank you for sticking with me up to the end of this video. Please don't forget to like, comment, and subscribe to my channel. And I can't wait to see you in my next video. Bye for now.